Hi, Dave with Align Therapy here. We are going to talk about my top 3 stretches for someone with low back pain. This is low back pain, this isn't upper back pain. We have other videos specific to upper back pain. Low back pain is very common in our society. This is Bea. Bea's a patient of ours here at Align Therapy. She's agreed to help me out with some video instruction. We were just talking about how prevalent low back pain is in the US and in the world. I mean, you hardly find someone who hasn't had back pain, and with sitting and not being as active as we should, back pain is very common. And so these stretches hopefully will help if you're having back pain or someone else is having back pain, to help relieve some of that pain. And keep in mind that I haven't evaluated your back. I'm not 100% sure that these stretches will help your back, or if they will hurt. So if you have any concerns, please contact your doctor, or better yet, a physical therapist that knows what they're doing about back pain. So just a plug for that. If something hurts that we do, please don't do it at home. Check with somebody and make sure we're good. So the first stretch is a Piriformis Stretch. It's one of my favorite stretches for low back pain because a lot of times our hips get locked up. So maybe go ahead and lay on your back here. The way we do this, bend this knee here, and then I'm going to have her put her foot up here on her right leg. She's going to put both hands behind her right knee, and she's going to pull up until she feels a stretch back here in the glutes. So you feeling a stretch there?
Oh, yes.
Oh, yes. There it is. So hold that about 30 seconds. I usually have you do 2 on one side and then 2 on the other. So let's try the other side. I do look at this to see if it's symmetrical, if the tension and the tightness is symmetrical, one versus the other. She's feeling that one too. So sometimes, go and bring that back down, sometimes we can't get into that position because things are so tight. So one way that we can do this without having to pull both legs up is we can take this knee and pull it up and a little bit across. So put your left hand here, and then trying to keep your hips on the table, we're pulling across, and you should feel it in the same area, the glutes, deep in the glutes, but then we're not having to pull as much up. So this is a different way to stretch the piriformis. We get some different fibers of the piriformis with this. You feeling that too?
Mm-hmm.
All right, perfect. So that's our Piriformis Stretch. That's number 1. Number 2, we have a hamstring stretch. There are a few different ways to stretch the hamstrings. If someone's having a lot of back pain, we did a previous video on the slump test, which is slumping down and bringing the leg up, and that can really light up sciatica. And you have to be careful with that because we don't want to round the back. Most people, when they go to stretch the hamstrings, will round their back and reach for their toe. We don't usually want to round the back with that. So Bea is going to do a stretch for the hamstrings using a strap. So she puts that kind of in the arch of her foot, and she goes way higher than I can go on this. But just gently pulling. Let's say she had tighter hamstrings than she has. So we would, even tighter than that. So like that's about where I am. So then gradually working your way up. Trying to feel a stretch in the hamstrings. We don't want this to be painful in the back, but trying to stretch the hamstrings this way. So that's good there. About 30 seconds with that too. With these stretches, we'll hold about 30 seconds for each of them. So go ahead and sit up, and put left leg off of the table, keep your right leg up on the table. So the way we'll usually stretch hamstrings is with the leg up like this and then leaning forward. And I usually don't have the person pull their foot back towards them when they do this because that tenses the sciatic nerve. But leaning forward, keeping your back straight, that's the key. So go ahead and try that. I think Bea is going to go a lot further than I would go again. So we're trying to keep the back relatively straight so we're not rounding and really reaching for the toes when things are tight. The back rounds if the hamstrings are really tight and the pelvis starts to tip backwards. And this looks great. 30-second hold, nice and gentle, nothing crazy. Feels good?
Yep.
All right. So the third stretch that we're going to do is, so a hip flexor stretch, we're just going to come forward, trying to keep your back straight again as you come forward, and you feel it in the front of the leg that's in the back. So the common problem with this is arching of the low back. So throwing your hips forward and arching your back. If you have joint problems in the low back or other issues in the low back, arching the back backwards can be painful, and so we want to keep that in neutral. And one way we can do that is by tipping the pelvis backwards, a posterior pelvic tilt, so that we're not arching this way, we're tipping back the other way. And you can usually feel it pretty good on the front of the hip with that. So one other way that we can do this is with a chair. A chair with it doesn't have to have an arm on it, but a back on the chair. So yeah, come on over here. So you're going to put your knee in the middle of the chair, and then your other leg is going to go forward towards the back of the chair. You're going to hold on to the back of the chair and just bring your hips forward. And what I was talking about before with not arching your low back, if we take your pelvis and we tip it back, then we keep the back from arching, and usually we'll feel a better stretch in the front. Bea has a lot of motion, a lot more mobility than most people that have back pain have. So be careful with this, don't push too far forward, but the hip flexors tend to get tight when we're sitting for a long period of time, which a lot of us do. So let's try that on the other side as well. Bea, let's move this way a little bit. So knee in the middle of the chair, coming forward, posteriorly tilting the pelvis so that we get that stretch in the front of the thigh. Great stretches, that's number 3, and hopefully these are helpful. So if you're having back pain, you can do these to try and help relieve some of your pain. If this is causing more pain, please stop and ask someone for some help on identifying what's causing your back pain. If these are helpful, fantastic. I'd love to hear about it. Leave us a comment and look for our other videos on specific stretches and exercises for low back pain. Thanks for watching.